So tell me about your surgical experience from start to finish.
So I realized I had otosclerosis when I started graduate school studying audiology. It was one of those cases we were testing each other's hearing, and I felt like I heard better in one ear over the other. And lo and behold, I had what was determined to be the beginning stages of otosclerosis. And over the years, it had just gotten worse, only in my right ear, just gradually. In quiet, I was fine one-on-one, but in noise, it was obviously a lot harder. And I knew it was impacting my quality of life. I'm actually an audiologist, so...
Ironic.
Yes. Very. So I knew how to deal with it, but I realized I was struggling a lot and finally got to the place where I could take a month out of my life, or not even actually, just a few weeks, and not travel and not exercise. Those were my two hang-ups, but I realized that hearing well was much more important. So finally, about 15 years later, or maybe a little bit more, I decided to take the plunge, and I'm really glad I did, and I'm sorry I didn't sooner.
Yeah.
I had known Dr. Sperling for about 10 years prior, and decided just to go forward with it, and from start to finish, it was a piece of cake, really. I mean, there was no pain post-surgery. I relaxed for a few days, slept a lot, which was kind of nice actually. And again, there was no pain in the ear, a tiny bit in my hand, but nothing that was, just from the grafting.
Yeah.
Right. And I really just, it was, when I went back for my follow-up and the packing was removed, it was astonishing. I couldn't believe how loud everything was. I knew that holistically, I was making up for my loss in hearing in many ways. Body language, stress, compensation by turning my better ear in. People had to situate themselves differently to accommodate me, or I had to move to accommodate myself.
Right.
And so after the packing came out, the sounds of New York City just were kind of overwhelming, to be honest.
I know, I can imagine.
Yeah, it sounded like a little mechanical, more like a hearing aid that I had tried years ago. And I was really surprised by that. So at first I kind of stayed indoors, was kind of shy to the outside world just because there's a lot of honking and sirens that happen around here. But within a couple weeks, my brain adjusted to it, and I can have people sit to my right side in restaurants. I can talk on the phone with my right ear. I'm still adjusting to it. We're about 1 month out, but my hearing's almost within normal limits.
Nice.
And it was actually nice to take a little break from working out, and I had to stay put, so I was able to focus on different things.
Yeah.
And it's all good.
And so it was the outcome, the difference was almost immediate, like a week after the surgery, you were able to see that it worked.
Oh yeah.
Okay.
It definitely worked. I was like, a little too much. No, but there's definitely always going to be, and it's the same way as I counsel my patients when I fit them with hearing aids. There's an adjustment period. You're used to hearing in a certain way, and then all of a sudden you're giving it back. Except for I wasn't able to turn it down.
Right.
So I was.
No, you can't adjust it that way. So.
No, with the hearing aid you can turn the volume down, but I was just forced to go for it, and I had no choice. And so it was really amazing to go through that process and readjust to hearing again. But I'm almost glad that I experienced the hearing loss. I know it sounds strange. It actually came in useful for sleeping, but I was actually glad to experience so I could relate to my patients.
Yeah, definitely.
So it was actually ended up being a good thing, and now since I was able to reverse it, even better.
Even better. It's never too late, right?
No, go for it. Don't wait. Just do it. Just make some time. It's worth it because I think it affects everything. Your stress, your things you choose to do, participate in. Even if you don't think it does. Maybe in quiet one-on-one, you're okay with one ear if that's your situation. But, you know, inevitably you're walking down the street with someone and you can't hear as well. There's just so many environments where it does affect you. And the surgery was, you know, simple. Everyone at the hospital was great. Dr. Sperling was great. Easy.
Good.
So, yeah.
Well, and you don't need it on the other ear. It's
no, my hearing's normal on that side. Great. So that's how I was able to get along all this time, which is 1 year. But, you know, there's no, like, if you can have the surgery and it's an option for you, there's no reason why you shouldn't.
Right. I think it's nice to hear that that it's pretty painless.
No pain.
Before and after, that it's just like, you know.
I was surprised. I was like, how is it possible that my eardrum, that, you know, I went through the surgery, and there was like no pain in my ear. Yeah. So it makes it a more positive experience. Yeah, and it just, like I said, for me, I did it on a Friday, and I was back at work, I think on Tuesday or Wednesday, and I just relaxed, was pampered a little bit, and yeah.
Nice.
Yep.
Great. Well, thank you, and good luck hearing.
Thank you.
I mean, enjoy it.